Today I'll be talking to you about Down syndrome, specifically trisomy 21. Symptoms usually are identified at birth or shortly after, and they range from mild to severe. The physical signs are skin at the nape of the neck, flattened nose, wide short hands with single crease, short fingers, eyes that are small and slant upward, bush-filled spots, heads that are normally shaped, and the big toe widely spaced. They often have delayed mental and social development that causes impulsive behavior, poor judgment, short attention span, learning disabilities. And medical conditions are heart problems, dementia, eye problems, gastrointestinal blockage, hearing loss, airway blockage during sleep, and hip problems, compression of the spinal cord, and usually children with Down syndrome suffer from obesity. Down syndrome is caused by a genetic error in cell division called non-disjunction, which is the failure of homologous chromosomes to separate normally during cell division. This results in an extra chromosome that's replicated in every cell of the body, and it occurs at conception, and it's not the mom's fault, or she didn't do anything during the pregnancy, and it's a mutation that occurs at random event during the formation of reproductive cells. Now, Down syndrome is a genetic condition in which a person has 47 chromosomes instead of 46 due to non-disjunction. And trisomy 21 occurs when there is an extra copy of chromosome 21. And this is 95% of all cases, and the extra chromosome affects the body and brain development. Down syndrome is not related to race, gender, nationality, or anything like that. But it does increase, the chances of it increases with advancing maternal age. A person who's 20 years old will have chances 1 in 1,500 of having a baby with Down syndrome, and when they're 45, they'll have chances of 1 in 30. And 80% of children with Down syndrome are born to women under 35 years of age, and 1 in every 691 babies born in the U.S. have Down syndrome. There's not really a treatment for Down syndrome. You just have to control the symptoms and manage any medical conditions. So you can do behavioral training, surgery, special education programs with special educators, speech, physical, and occupation therapy, antibiotics, and medicines, and healthy diet and exercise. And they also need to go for regular checkups and screenings. New treatment scientists have come with a new theory that the deficiency of protein in the brain of Down syndrome patients could contribute to the mental impairment and heart defects at birth. And an experimental drug called agmomir acts on the RNA segments in the brain and regulates the protein in the brain that can cause that can return the brain to its normal levels. Coping with this disease, actually, this is my cousin David, and he has Down syndrome. And it's important just to be patient and understanding, because they do get frustrated often, and just to love them and treat them like normal and like you would want to be treated. It's important to remember that, even though they're different, they have so many talents and gifts that they can contribute to the world. And the main thing is just positive support from family, friends, and community. This enables people with Down syndrome to develop their full potential and fulfilling lives.